Well, tonight the Carter-Jenkins Center is going to present a lecture on adult suicide. And there you have the speaker, myself, and it's an interesting, though tragic, and very sad subject, as you are aware of, and you will see in a moment the amount of people who unfortunately loses their life through suicide. And it is not an easy thing to round up either, because the information, though there is a significant amount of information available, usually is collected, is behind several years in any case. So I don't have information from 2008 to certainly 2009. And there is the other factor that many countries don't collect any information in this regard, and some of the countries that collect it have lied about it for political reasons. But in any case, I have an enormous amount of information that I hope you will find useful. Adult suicide, as I said, and this is important, the information that I present you here refer mostly to this country, the United States of America. But this is really a universal problem, and there are 37 other countries that have a much higher rate of suicide than the United States of America. Suffice it to say that in the year 2000, the World Health Organization estimated that approximately 1 million people will die by suicide across the world, and that 10 to 20 times more people would have attempted suicide. That's to say that at least 10 to 20 million people would have attempted to kill themselves because the proportion of attempts to actual suicide is 10 or 20 to 1. Now, this actually represents one death across the world every 40 seconds, and one attempt every 3 seconds on average. This is taken globally across the world. You have here the figure that has the global suicide rates per 100,000 by gender in the years 1950 to 1995. As you see, it's a little old, but it gives you some significant information. For example, you look down here, you have in every year, in 1950, 55, 60, is in periods of 5 years, the number of males that did it per 100,000, 16.6 males, and 5.2 females completed the suicide. As you see, is at least 3 times, sometimes even more than 3 times, the rate of suicides in males, and that is in real suicides ending in death in males than in females. If you look at the year 995, you can see that males was 24.7 per 100,000, while females is 6.9, which is close to 4 times as many. Here you have a ranking of the top 10 countries on the left-hand side of this slide by number of suicides, and this estimated by the year 2000, it's 9 years old, and suicide rates, and this is the most recent year available. Here you have that China heads the top with 195,000 suicides, followed by India, 87,000, Russia 52.5, but this might not be a reliable figure. The United States 31,000, and so it goes, followed by Japan, Germany, France, Ukraine, Brazil, and so on. And here on the right-hand side, you see how the number of suicides by 100,000 people diminish, which is interesting. This is a map of the suicide rates, and you see the ones in red in this map, which is all of this area of, most of Europe and Asia and Australia, is the suicide rate is higher than 13% per 100,000, and this is the year that is more recently available, which was 2002. You see here the United States and Canada oscillates between 6.5 and 11, and of course South America is less than 6.5 in the year 2000. This was taken from the World Health Organization, but as I told you, with the exception of the United States and a number of other countries that take these statistics very seriously, some countries really don't take them, or somehow, distort the figures. In the United States, 3 years ago, which is the most recent statistics that I could get, that is in the year 2006, 33,300 persons committed suicide. Finished. Ended their life. And well over 30 suicides took place each year before 2006. So that figure is pretty stable. Thus, in this country, suicide is the 11th leading cause of death, but the third for the young. It's the 11th leading cause of death in adults, but the third for the young. Estimating suicide attempts, and this is modestly, at 10 times, as you see the figures oscillate between 10 and 20 times the reported number of suicides. At least then 300 persons attempted suicide in any given year, assuming that you take the 10-time figure. If you were to take the 20 times attempts to complete a suicide, then you will have a figure of 660,000 attempted suicides in this country in a year. Here's some general information so that you see the horror of the problem. By this time, 7 o'clock tomorrow, 84 persons would have taken their own life. That is 1 every 17 minutes, and at least 800 would have attempted to do so, always thinking that you are using the 10%, but remember it's between 10 and 20%. If you use the 20% figure, it would have been 1,600 would have attempted to do so in 24 hours. An average of 3 to 4 men complete suicide for every woman that completes it. Women, on the other hand, attempt suicide 3 times as frequently as men do. Now, the rate of suicide among married persons is 11.3 per 100,000, and you will see how that varies according to the condition. For example, the rate among single, never married, is about 20%. That's considerably higher than the figure for married people. For widowed males, is 24% per 100,000. And the rate for divorced male is, and this is a surprising figure, is 69 per 100,000 people, while for divorced females is only 18 per 100,000. Now, here you have the methods that are used for people when they attempt suicide by gender, sex. And here you have the method. Firearm and explosive, men very frequently. Number of suicides, you know, in total of the different methods was 25,000 practically, but of the firearm and explosive was 15,104. And the women percent of that total was 38.4%. That is 2,320. Hanging, strangulation, and suffocation, you can see, is 19.2%, over nearly 5,000 in men and only 1,000 in females. Now, in this, you have the gas poison here for male and females. The solid and liquid poisons, they get pretty well together, males and females, in the numbers. And in all other methods, you can see the figures. Here there are all the methods of suicide: jumping from high place, cutting and piercing, drowning, jumping before a moving object, usually a car or a train or something, or an omnibus or something of that sort. Here you have the number of suicides, and that's complete suicides in males, 26,308, and in females 6,000, practically 7,000, for a total of 33,300 completed suicides that we have seen. Now that's in a population, in the case of the males, of 26,308. The population of males is 147 million, and so the rate is 17.9%. You look at the females, in a higher population of 150 million and a half, the rate is only 4.6%. Here you have an idea of the number of suicides that take place by age group in relation to the population in that group and the rate, which, for example, in the 5 to 14 years of age, there were 219 suicides, and the population for that group is about 40 million, and the rate is 0.5%. The higher one is in the group of, as you see, 45 to 54, where there were 7,426, and it was not too far from the 35 to 44, and so it goes. And less suicide, let's say, take at the 75 to 84, it was only a little over 2,000, but there are only 13 million, for a rate of 15.9%, so the rate is pretty high, though the number seems smaller. But if you think of it in terms of the total number of people in that age group, then it's very, very high. And there was people of 85 years and more, there were 140, which seems like a small number, but that group comprised only about 5 million, a little over 5 million, and the rate was 15.9%. If you combine all of them, it's 33,300 suicides in a population of nearly 300 million for a rate of 11.2. Now, this is some more general information which is of interest. The suicide rates are actually highest in older white men. Almost all the suicide victims are psychiatrically ill at the time of death, with one thing or another, as you will see in a moment. Many suicide victims have been in psychiatric treatment shortly before the event. May have been discharged from a psychiatric inpatient unit or seen a psychiatrist and put in some medication or another. All the studies that we have reviewed show that depression and alcoholism are the diagnoses that account for 2/3 of all suicides. Now, very severe depressed patients are 500 times more likely to commit suicide than men with no psychiatric diagnosis. Something that influences the decision to commit suicide is undesirable events such as blow to self-esteem, object loss, personal sickness, and all of these things precede suicide frequently. Humiliating events in the areas of work and legal problems were especially ominous, and this is true of adolescents as well. Humiliations in school and so on, not uncommon, and may lead a depressed adolescent to suicide. Let's talk a little bit about suicide in women, general information. Suicide is more common among single women, divorced, separated, or widowed recently. As mentioned, they attempt suicide 3 times more frequently than men. And the problems, losses, or crises in social or family relations tend to be the triggering factors in the females, any number of problems. The suicide rates in women tend to peak between the ages of 45 and 54 and after 75 years of age. The frequency of completed suicide for females is 4.5 per 100,000. Now, firearms are nowadays the preferred method in women, and that's a new phenomenon. In men, suicide increases with age, and much more so after age 65 and upwards. Thus, the rate of suicide at 65 plus is 7 times higher than in women of the same age. On average, there is an elderly suicide every 90 minutes. Depression and social isolation are strongly determinant factors in this group. Men, as we have said, complete suicide 3 to 4 times more frequently than women. Men's completed suicide tend to peak between 45 and 54 years of age and after 75 years of age, when the rate is 37.97 per 100,000. That's pretty big. The leading method of suicide in men are to firearms. And in this, women have come to use the same method nowadays, but not so in the past. Now, this is interesting. The suicide among the military is important. and a painful loss to the nation. The stress of war is a significant factor. Suicide among active duty and veterans, military personnel, has increased tremendously since the year 2003. In 2007, and these are relatively recent statistics, up to 2,100 soldiers in the army attempted suicide, with more than 100 completed suicide. But as you see, the rate there is about 20 to 1 attempts to complete the suicides. 1 in 5 people who complete suicides in the United States is actually a military veteran. Sad thing to say. Now, suicides in the emergency room. In the year 2005, 372,722 people went to an emergency room for self-inflicted injuries. That's comprises suicide and mutilations. In the year 2006, 162,359 people were hospitalized for self-inflicted injuries. In 2006, intentional injuries actually accounted for 2.5 million, that is 5.9, nearly 6% of the visits to emergency departments in the United States of America. Which is quite a problem. Now, coming back to the methods used. Methods tend to vary with locality, with tradition. There is a suicide tradition from that they commit suicide, economic means, and different other factors. The first one is firearms, and become now, as we have repeatedly said, for both men and women. Hanging follows. Medication, drugs, or poison are in the third group. Gas poisoning afterwards, carbon monoxide, cars in garage, and things of the kind. Jumping from buildings, bridges, etc. And sometimes in some places where there are especially tall buildings or bridges and so on, it becomes a kind of a tradition. People go there and jump. And here in Tampa, where I live, there are such places where people tend to do this. Now, occasionally there are people that jump in front of trains, car, omnibus. The next one is cutting, stabbing, and slashing. And finally, drowning. And a good example of drowning is the very famous English writer, Virginia Woolf, which drowned herself in a river. What she did is she walked into the river with a coat and had filled the pockets of the coat with very heavy stones so that she couldn't get herself out of it once she walked into the river, because she had attempted it before and kind of panicked at the last moment and got herself out of there. So when she finally completed the suicide, in order to avoid the possibility of getting frightened and getting out of the river, she did it in such a way that that was not possible even if she got frightened. Now, this here is some methods of suicides. This is data from 1998, but it seems that the figures more or less remain reasonably stable. And here you have the firearm and explosive at the top with 57%, hanging, strangulation, and suffocation much less, 18.7%. Poison, that years ago was a common way of attempting suicide, particularly among females, is now only 10.9%, gas poisoning 5.6%, and other methods are 7.7%. Jumping from high place is 2%, And so you see drowning is 1.2, jumping or lying before a moving object is 1%, and burning themselves, some form of fire used in the suicide, it's a small proportion of 0.5%, though in the past it was a little higher than that. Some people, as you can see, use the car, the vehicle, to commit suicide. They just crash against a lamppost or a tree or whatever. In 2006, the firearms accounted for close to 17,000 deaths out of the total of 33 completed suicides. That is 5.6% per 100 of population. And suffocation accounted for 7,000, practically 500, 2.5 per 100,000. Poisoning for 6,000, 2% per 100,000. And suicides account for 1.3 of all deaths in the United States. Now, identification of the risk factors, nosology and suicide. Common in depression, particularly in certain forms of depression that in the past have been called endogenous depression, though people that have reactive depression can on occasion commit suicide as well. In alcohol abuse, alcohol is involved in the suicide attempt with enormous frequency, as we will see in a moment. Schizophrenia, a lot of schizophrenics attempt suicide and complete it, a number of them. In bipolar disorder, in panic disorder, in medical illnesses, and then there is some slight connection between creativity and depression, as I will show you in a slide in a moment, though strictly speaking, what is the connection is difficult to say. Post-traumatic stress disorder is another cause of it. Eating disorder is a cause of suicide. It's infrequent, but it does happen, and some personality disorders just as well. In depression, most depressed people are actually not suicidal. Nevertheless, as a risk factor, depression is at the top of the list. It is a factor in 40 to 70% of suicides, and 2/3 of those that died by suicide had a depressive illness. It's interesting to refer to the fact that there seems to be a relationship between low concentrations of the serotonin metabolite 5-hydroxyindoleacetic acid, 5-HIAA, in cerebrospinal fluid and increased suicide. That's a common finding. Now, 30% of depressed people will actually attempt suicide. Psychotic depressions, which in the past were called endogenous depression, are about 5.3 times at higher risk than non-psychotic depressed patients, the reactive depression. In fact, depression is a common affect, which results, as a consequence of a large number of different events. Losing job, losing a partner, losses, we see before humiliations, all kinds of things. But the psychotic depression are very seriously in danger of suicide and this has to be considered very carefully. Now, adult patients with mixed states or undergoing a switching polarity, manic depressive patients, for example, are particularly vulnerable to suicide. Patients that were manic and turning very depressed. And this is a very recent study, in fact, from this year, March 31st of 2009, from the Harvard Medical School that was published in Molecular Psychiatry claim that though depression is the most frequent cause of suicidal ideation, it doesn't predict as well whether they will make a suicidal plan or an attempt. However, they thought that anxiety disorders, impulse control disorders, and substance abuse disorders did become better predictors. Thus, individuals thinking of suicide that had a bipolar disorder were more than twice as likely to make a planned suicide attempt as individuals without this illness. Now, let's go to alcohol abuse and or drugs. Alcohol abuse is a very high risk factor. Anywhere from 21 to 89% of the time, alcohol had been consumed prior to the suicide with that frequency. Because alcohol disinhibits, individuals overcome their fears or whatever constraint they had to commit suicide once they have become drunk or have become, high on alcohol. And all the prohibition against violence is overwhelmed by the drinking of the alcohol. Suicide usually coincides with the onset of medical complications, for example, cirrhosis, or the loss of an important relationship. And when that is the case, it happens frequently within 6 weeks or less of the time of the suicidal act. That is, the loss of an important relationship took place 6 weeks or less before the attempted suicide. Now, toxicological tests in 13 states in the United States of America of those who committed suicide show the following. 30.3% tested positive for alcohol, 1 in 3. 16.4% tested positive for opiates. 9.4% tested positive for cocaine. 7.7% tested positive for marijuana. And 3.9% tested positive for amphetamines. So as you see, the mixture with alcohol and drugs and depression or whatever other form of disorder that may lead to suicide, like anxiety disorder, is a lethal combination. Now, as a point of interest, let me tell you, which is not related to suicide, that the United States Drug Enforcement Administration has said that near 8 million Americans have used prescription drugs. 8 million Americans. That means 1 in what? 1 in 40 people or 35 people, something like that. And this is a quote. More than the number who abuse cocaine, heroin, hallucinogens, ecstasy, and inhalants combined. That's prescription drugs abuse. It's more than the number who abuse this 8 million. It's more than the number who abuse cocaine, heroin, hallucinogens, ecstasy, and inhalants combined. Prescription drug abuse killed over 8,500 Americans last year, in 2008, according to the Office of national drug control policy. So as you see, this is something to pay a lot of attention to and be very alert to. In the schizophrenics, the risk of suicide in schizophrenia is comparable to that of patients with affective disorder. That is 10 to 13%, so it's pretty high. The risk, it seems to be greater earlier in the hospitalization and just shortly after discharge. The hopelessness and fear of mental disintegration were more critical than psychotic symptoms in the prediction of suicide. So hopelessness and fear of mental disintegration. 20 to 40% of schizophrenics make attempts and 10% of them will complete the suicide eventually. Now this is in medical illness. Terminal illnesses accompanied particularly by pain, loss of function, alienation, disfigurement, and so on, may precipitate suicide in the vulnerable patient. It is important to remember that most medically ill patients that commit suicide, even those with terminal illnesses, have at the same time a concurrent, and this is important, treatable major depression. Now, this medical illness, which is a common phenomenon, is very common in cancer, in situations like Parkinson's disease, in people that have had a stroke, coronary artery disease, heart disease, Alzheimer, and other forms of dementia and so on. I mentioned to you earlier some relationship between creativity and depression. This is not quite clearly established, but some people think that there is something to this. For example, poets are likely to suffer 4 times more frequently from depression, and as such may be at greater risk of suicide than the general population. And examples are Dickinson, Eliot, and Poe that suffer from it. Writers too seem to be riding in the same boat, and here examples of these are Balzac, Conrad, Dickens, Emerson, Faulkner, Fitzgerald, Ibsen, Melville, Tolstoy, and Virginia Woolf, and so on. Musicians as well seem to sometimes suffer from this, and the examples are Rachmaninoff, Schumann, and Tchaikovsky, Irving Berlin, Charlie Parker, and Cole Porter, all of which tend to suffer from severe forms of depression. And painters like Van Gogh, which ended in suicide, Gauguin, Jason Pollock, Georgia O'Keeffe, Mark Rothko, etc., seem to have suffered from severe forms of depression. Now, the clinical assessment of the risk. Suicidality exists as a spectrum that goes from a non-specific suicidal ideation, such as thoughts of death, to thoughts of one's own death, and finally to suicidal thoughts with a plan and intent to die. And obviously this is a group that is in an enormous danger once they have got to this stage. Hopelessness is a better predictor of suicidal thinking than depression per se. A history of previous attempts significantly increases the suicide risk. And other issues that are important in this area are a psychiatric diagnosis, we have seen some already, suicidal intent, the intentionality, the method that is being contemplated. This is very important because some of them, of course, are lethal. It means they have the instrument at home. That is a red flag immediately. This patient should be probably hospitalized very quickly. the severity of the hopelessness, more than the depression feeling, the hopelessness, is a very important factor to consider and an important red flag. The clinical assessment of risk, essential to diagnose the presence or history of an affective disorder. And this may be a familial problem, and there might be a history of suicides in the family and things of that kind, and that, of course, particular population is at a higher risk than others. Second, the substance abuse, including alcoholism, that we already mentioned, and as you saw, is quite an important factor. Schizophrenia, which is just as high as the affective disorder, and the panic disorder frequently leads to suicide. All the above significantly link to self-destruction. Any one of these diagnoses can lead people to commit suicide. Other contributory factors that cut across psychiatric syndromes includes, as we mentioned, previous suicidal behavior, exposure to suicide, intra or extrafamilial. But intrafamilial is very particularly of a close relative. It's an important factor to take into consideration. Other family environmental stressors, personality variables, and medical illness, as we have seen. Now, remember that two psychiatric illnesses account for 65 to 75% of all suicides. Depression is the first one and accounts for 40 to 70%, and alcoholism and drugs account for up to 25%. The wish to die, also known as the suicidal intent, should cause the greatest concern among the professionals that are attending to this type of patient. Now, patients that should be admitted immediately to a secure, and I mean secure, not all of the psychiatric facilities are really secure, but this type of patient should be immediately admitted. Patients with formulated lethal plans. Patients who possess or can acquire easily the means to carry it out and have an intention to do so. Patients who leave notes, make wills, express suicidal intent, dispose of their possessions, patients that take some precautions not to be discovered have generally what is considered to be the highest suicidal intent, and as such are much higher risk than other patients. Remember that the single, the divorced, or widowed are statistically speaking at greater risk than the married. So in the presence of this factor, and depression or alcohol and drug abuse and so on, that's a bad combination. The idea, and this is extraordinarily important, that prediction of suicide is an easy matter is completely and totally false at this point in time. That is simply not true. Warning signs are giving away precious possessions, withdrawing from friends and activities that they used to enjoy, sudden or impulsive purchase of firearms and things of the kind are red flags in these patients. Now let's refer briefly to the murder-suicide, which happens in depressed people. More frequently done by men, enacted by men, though cases of women that have done this are known. The causes may vary. Spousal abuse, common background to it. Occasionally, the depressed patient may kill members of the family and then commit suicide themselves, because in the severe depression and delusional, quasi-delusional condition, they think that the world is going to be so awful for the family that the best thing is for everybody to go away. Occasionally, psychotic delusional patients will do that. They are told by God in a delusion that they should kill so-and-so and kill themselves, usually a relative. Merciful killings is not that uncommon and is followed by suicide, particularly in the elderly. You will come across this, unfortunately. And that concludes the lecture. Here you have some bibliography, which is the World Health Organization, and you have the web page in the internet that will allow you to gather further information in many of these subjects. There is the American Foundation for Suicide Prevention, and you have there again the internet address. Crisis Link and the Center Disease Control, and you have there the different addresses in the internet. So we have been glad to present you this painful subject, and this is an international informational community service of the Carter-Jenkins Center. But of course, particularly in this area, nothing that is mentioned here should be implemented without consultation with professionals. We're talking of something that is a very dangerous subject. So professionals, local professionals and patients with these conditions should be in touch with, are the ones that should make all the decisions. If you have any questions, you can refer them to the center and we'll try to answer them if we can. Thank you for your attention.